Good evening, and thank you for being patient through technical difficulties. I'm Dr. Jeffrey Sterling, Surgeon General of Alpha Phi Alpha Fraternity Incorporated, and on behalf of General President Willis L. Lonzo III, I welcome you to the Surgeon General Initiative's webinar this evening. Now, I have the pleasure of introducing tonight's moderator, Deputy Surgeon General, Brother Dr. Ron Kennedy Bailey. Brother Dr. Bailey serves as Chairman of LSU Health Science Center, Department of Psychiatry, and the Assistant Dean for Community Engagement. Brother Bailey's career has been centered on quality clinical patient care, forensic medical legal evaluation, advocacy, and community research. Brother Bailey received his medical degree from the University of Texas Medical Branch at Galveston in 1990. He completed his residency training in psychiatry at the University of Texas in Houston. While in residency, he was chief resident, and he also completed a fellowship in forensic psychiatry at Yale University. He has famously served as the 113th president of the National Medical Association and is currently chairman of the Cobb Research Foundation Institute. He has over 60 peer-reviewed publications that address psychiatric care, health disparities, and forensic practices. In 2011, he actually served as the chair of the Commission to End Health Disparities with the American Medical Association. It is my pleasure to introduce Dr. Bailey, who will introduce tonight's panelists. Dr. Bailey.
Thank you very much, good brother Sterling, and thank all of you for joining us this evening. Really, it's a pleasure for me, the opportunity to participate in this program in this role of Deputy Surgeon General for Mental Health for Alpha Phi Alpha. We've got a lot of work to do to ensure the health of our brothers and other African-American males throughout our country is well addressed. Our topic tonight is stress assessment and management. We have two outstanding panelists to join. I'll introduce them independently. First, we have Brother Shyamalan Johnson from New Orleans Healthy Minds and Private Practice. Brother Johnson is a board-certified psychiatrist with post-residency experience in psychiatry starting in 2008. He was first medical director for the inpatient VA psych unit after Hurricane Katrina and was responsible for creating the program for the ground up. He was accorded honor of admitting the first VA patient to the new hospital in New Orleans. He prides himself on giving individualized care with compassion and establishing a rapport which will give clients the maximum benefit for clinical treatment. Brother Johnson is comfortable treating with the geriatric population. He's really been helped to cover a geriatric unit for 5 years in private practice and provided consultations at a SNF unit for the elderly at a New Orleans General Hospital. He gives care to each individual that he would want his friends and family members to receive if they were individually his patients. Brother Johnson enjoys working with patients and educating their families on their conditions. He feels, quote, "It's always great to see them return back to their normal lives once clinically improved," end quote. Brother Shyamalan Johnson recalls a patient experience that he found very meaningful that I want to share with the group tonight. He stated, quote, "I have treated all kinds of patients post-residency throughout my career. One that comes to mind is a young man who was an artist with bipolar disorder. I was able to work with him and his family. He had ups and downs, but eventually earned his master's degree from a local New Orleans university. He invited me to his gallery opening. That was very memorable." That's your other brother, Shyamalan Johnson. I'll also introduce our panelists, our fellow panelist, Brother Richard Doss. Brother Doss is a clinical psychologist at the VA Hospital Readjustment and Counseling Service there in Chicago. He's a licensed clinical psychologist in the Department of Veteran Affairs in Chicago, Illinois, where he specializes in trauma, anger management, and marriage counseling. Brother Doss is from East St. Louis, Illinois, where his brother, also brother Alvin Doss, is president of Delta Epsilon Lambda chapter of Alpha Phi Alpha. Brother Richard Doss received his BS in psychology from Jackson State University, where he initiated the Delta Side chapter of Alpha Phi Alpha Fraternity Incorporated in the spring of 1987. He earned his master's degree at Ole Miss, and was the first African-American male to receive a PhD in clinical psychology from that university. He served his final year of his doctoral program at the old, quote-unquote, Cook County Hospital in Chicago, Illinois, where he was trained and worked in the trenches handling mental health for African Americans. Brother Doss is actually the author of 2 books. He's Gold Soldier, Suffer in Silence, and 52 Steps to Stop the Suffering. And his TED Talk, quote, Train Not to Cry, end quote, has received rave reviews. He's an Army-trained suicide prevention expert. He's observed an 89% reduction in completed suicides during his tenure with the Department of Defense in the 416th Theater Engineer Command, where he was a suicide prevention program manager for over 13,000 soldiers in 26 states and the territory of Puerto Rico. Brother Doss subsequently received the Civilian Medal of Service for that outstanding work. He notes that he believes that we all have stressors and we all have challenges. He indicates that whether diagnosed or not, in his words, quote, our greatest wounds are often those that others cannot see, end quote. Finally, while serving our country, he also serves his community as an active member of Theta Mu Lambda chapter of our fraternity there in the south suburbs of Chicago, Illinois. Clearly a good quality work, I think, in the community and academic professionally by both brothers Johnson and Doss, and look forward to their discussion tonight with this, addressing this topic of stress management. Let's kind of jump right to it. We've had quite a few practices in this regard, and I think that we all are very much aware that discussions regarding stress in our community can be extremely difficult. Some persons, because of their concerns or fear of being seen as weak or unable, may not share with clinicians what those concerns, how they're affecting them. And also, many would argue that men in general, and I might argue that African American men particularly, may have additional barriers to acknowledging those difficulties over time. Dr. Johnson, let's go to you first and hear a little bit of your thoughts about how you've worked to address concerns regarding stress management in your patient population.
Dr. Baylor, just a few alpha housekeeping rules. I forgot to mention I'm a spring 1998 initiative of Beta Sigma at Southern University, and I'm currently a member of Sigma Lambda here in New Orleans, so I wanted to clarify. I think we wanted to talk about what exactly is stress and what is the origins of stress. So stress is primarily a natural reaction from the body. This is the typical fight versus flight idea that there's a perceived threat. Either, your brain feels like something is going on abnormal. So stress can be, it can be a good thing that, hey, this something is happening. Somebody is chasing me. Somebody is, after me, or, this big thing in my life has happened. And so normally your body naturally should respond to stress, and then eventually your body should go back to a normal state. And what happens, especially in our society now, is that sometimes this stress kind of never goes away. And I wanted to talk about how do we identify stress, and what is it? What does it look like? So stress can be anything from, I feel something is happening in my life and I feel these emotions. I feel anger. I feel tense. I feel worried. I feel irritable. I feel upset. It could also manifest itself as some sadness or depression. Could also, and a lot of times in people, we see these physical health symptoms but there's no medical cause. So someone that is having, constant headaches and their medical workup is negative, or they're having constant stomach pains and they go through all of these tests from, scopes and, swallowing studies, all of these things. And, what really is triggering them is their response to stress. And so those are the things that I think people can identify with, and what, kind of makes us do that. And so that is kind of an overall idea of, how do you identify, what's stressing you out? So it could be emotional, it could be physical, you could experience what some people call burnout. And so that is what we talk about. And how do you, manage that, once you identify that. So a lot of it is, I break it down into three things, really is one is what can you really control? I mean, so a lot of stress deals with our environment, whether it's home, whether it's work, whether it's personal, whether it's business. Some things we can control, some things we cannot control. So we first have to decide, what can we control? And the things that we can't control, you may not be able to change your boss. You may not be able to change, where you live at the moment or your particular station in life, or you may not be able to change, how much money you're making immediately, or, there are various things. So if you can't, if it's something you can't control, you can control to an extent, how hard you're working or who you're working for. But when you get to the point where you've done all you can do to control it, the second part is really how do you react to that? So you have this stimuli, this boss, this job, this child, this, kind of condition in your life. How do you react to it? And so that's something you can also work on. You know, how do you react to these stressful things that are happening, you know, in your life? And so a lot of time we worry more about controlling, but you know, one of the key things is that we all can adjust to is how we react, because you know, the things that we can control may be very limited, you know, depending on who we are, what station we're in, what's happening. I mean, like, for instance, if you're, you know, if you get sick, you get, I'm just going to throw, you get cancer. You may not, you can't sometimes control getting cancer, but how do you react to it? You may not be able to control at this moment, you know, who your supervisor is at your job, but how do you react to that? And so, you know, really concentrating on how you react to that is very important, because that reaction will kind of drive the stress. So if you react in a very positive way, that could really lower your stress. If you act in a very negative way, that could either further your stress. So trying to decide, how do I cope? How do I react to those things? Part of reaction, you know, that we don't do probably well as, you know, males, as other people, is asking for help and seeking support. And, you know, we need to ask for help. Sometimes people don't realize that you're stressed. They don't realize you're overwhelmed. You know, we get lots of people in the hospital who, you know, we ask them, hey, did your family know? Did your wife know? Did your neighbor know? Did your children know? Oh, no, I didn't want to bother anybody. I didn't want to tell anybody. So, you know, really trying to check that before it gets to the point where you develop, you know, major depressive disorder or you become suicidal. You know, seeking support and seeking help. And that support sometimes can be in the form of family, could be friends, could be a support group. You know, those sort of things are really important. And when you seek help, to really be honest and open. You know, sometimes people are very embarrassed. There's a lot of shame. There's a lot of guilt, a lot of stigma in seeking help. You know, whether it's something, you know, as simple as stress versus, you know, a axis 1 or something like major depressive disorder. So really, you know, being open and honest and kind of letting down that barrier to seek help and support from others is very important.
I'm going to jump on that. I think it's a tremendous point, yes, Dr. Johnson, and this issue about barriers that make it complicated for individuals to seek help. And some of those may be even more difficult, I think, for some populations, including the men in our fraternity. I'm going to move it to Dr. Doss to give a chance to kind of share some of his thoughts about how he's worked with persons who maybe experience some of those type barriers.
On a daily basis, I work with combat veterans and victims of military sexual trauma. One of the things that I've learned as we begin to talk about this thing called stress is that oftentimes men don't talk about their stuff. In the military, the way that it goes down is that men are taught to suck it up, drink water, and drive on. If you have a problem, you keep it to yourself. And so you say, well, is that something that starts in the military? Is that something that starts when you join a fraternity? Or is that something that started when you were 3 years old and your father or your mother said that when you fall, that you should just get back up and not cry? I was sitting in a group the other day, a PTSD group, and a brother was talking about losing his 97-year-old mother. And he said he hadn't been able to cry about it. The more he talked, the more he started to cry. And he said that he felt weird because he was trained that men aren't supposed to cry, that men have to be tough. And so the question then becomes, as a man, where do I talk about my challenges? Where do I talk about my problems? Where do I talk about my stress? As men, oftentimes, and especially as African-American men, the conversation is, as we think about therapy, we say things like, I might have problems, but I'm not crazy. And so the question then becomes, do I have to be crazy to talk to somebody about what's going on? Now, one of the things I want you to take note about this conversation is that this is pre-diagnosis. So typically, I don't treat people day to day just because they're under stress. So, you know, usually by the time somebody's in my office, it's because of anxiety, it's because of depression, it's because of post-traumatic stress disorder. It may be anger management issues or maybe marriage counseling. But just day-to-day stress, we don't talk about it. I would go as far to say is we kind of normalize it. The idea is that if you have been living in a stressful environment, working in a stressful environment for a long time, that can become your normal. Right? And so if I'm used to, having to meet billable hours, if I'm used to having a lot of people that have to answer to me, if I'm used to trying to deal with the bottom line in my new business that I started, if I'm used to not having enough money to meet my bills monthly, if I'm used to my children being in trouble, or me not having a good relationship with my wife, those are things that we talk to other people about. So I think about, me sitting in our chapter meetings. Brothers talking about the new business they started. Can you come and support me? They might be talking about the fact that they recently lost someone that they loved, and brothers will come there and support them. The question then becomes, when I'm in a bad place, an unhealthy place, a stressful place, when can I talk about that? Who do I talk about that? Do I have to be guarded about who I talk about my stressors to? And you'd be surprised. It's typically not the big stuff that gets people. It's the little day-to-day stuff. I did some work back at Fort Bragg, doing some suicide research with combat veterans. And so we would do psychological autopsies and try to figure out what was the biggest stressor that contributed to the suicide. And a lot of people would, thought that it was because they had been in combat and maybe they had taken a life and they maybe lost a friend. The truth was, the biggest stressor was relationship problems. The second biggest stressor was financial problems. And the third biggest stressor was legal problems. When you have these problems, who do you turn to? Success comes at a price. So the idea is that the failure and hard times isn't the only thing that stresses us out. It's good stuff that can stress you out too. Getting a promotion can be stressful. Trying to find a new house can be stressful. Trying to work out your relationship with your wife or your significant other can be stressful. I just took my son down to college, first year in college. Went to Morehouse, parent parting ceremony. It wasn't a dry eye in the house. People stressed about, man, will my son be all right? What is life going to look like for me? So success comes in various ways, and it has a price. When you are stressed, do you know what your stress looks like? Then the other question becomes, if you do know what your stress looks like, do you know what to do when it feels overwhelming, when it feels like it's too much? I read something earlier today that said this: it's not that you are typically asking for too much in life. Typically, you're asking the wrong person. So I'll say this: it's not your boss that can fix it. It's not your wife that can fix it. The person you have to ask is, man, is there something that I can do to change this? Is there something that I can do to make this healthier? The price of stress and headaches and insomnia or hypersomnia, heart attacks and strokes, that price is too high. I was having a conversation earlier this week with somebody, and I asked this question: is there a dollar figure that makes high levels of stress totally acceptable? Hopefully, the answer is that your stress has a high enough value and priority in your life that you can begin to start this thing that we talk about, that some people don't like to use this word that I'm about to say, but it's a very important word, and we can continue the conversation because this is the beginning of a conversation. What does balance look like in my life? So, does 6 figures give me balance? It might give me financial balance, but I can guarantee you that 6 figures won't fix it.
You make some remarkably timely points. I think issues that are relevant for all of us. I love the 1, 2, 3 issues. I think in the study that you referenced that I think are probably likely in the lives of many of our members and African men in general. And I think that the issue of relationship is huge. The issue of finances are huge. There's some who argue that part of the struggle between in developing relationships is that some persons think that, why can't a man commit? And others might argue maybe men are trying to get their finances in order first, and that may lead to an imbalance, I think, in the thoughts around relationship building. And issues regarding legal. I'm a forensics counselor by training. Goes without saying that there's just a myriad of legal consequences. Some we think are fair, some may even argue unfair, that often befuddle many of us and our friends and our colleagues and our relatives and our brothers that are remarkably complex. Let's deal a little bit with the issue regarding relationships, stress, of financial stress, and legal stress. I think these are all huge parameters for, I think, all brothers who may be on the call tonight or people on the call who may know someone else in their own life experience who may be struggling with these types of issues or concerns. Dr. Johnson or Dr. Doss, who'd like to kind of jump into that? Let's talk about relationship stress.
Yeah, I mean, I think that's really big now because you see people getting married, later in life, or people not even getting married and saying, I need to really work on myself and have myself together before I get married. I think one of the things that is very important is that people, again, not to go back, but that they know themselves, they understand their stressors and their triggers, and that they develop some coping skills and some practices, because these things are going to they're going to happen. And so when you're in, when you get into this relationship, what are the self-care and practice things that you've already committed to prior to this? And then what is it, if you get into this relationship, what is it that you could do, with your significant other to reduce stress? So one of the things that I tell clients is, always make sure, that you are recognizing this and addressing it before it, spills off into your relationship. So, one of the things I tell people is that, what is your self-care routine? And people, self-care is a big buzzword now, but, it's not what people think. I mean, it's not taking the, $8,000 trip to the Maldives. I mean, that's great if you can afford it, but, most people can't. So that could be, spending 10 minutes each morning meditating, or, walking around, during your lunch break, or, taking your significant other out dancing, or going on a hike, or, just listening to music, or dedicating some time for that self-care to develop yourself and your coping skills. So, because we all know relationships are stressful, right? I mean, relationships, from, there are going to be trials, there are going to be tribulations, there are going to be things that happen. And so if you have developed your own self-care and how you deal with those things, then when you get into this relationship, you can incorporate some of those things into it. And the other thing is really, I saw a client about 2 weeks ago, and this was her third marriage. And I asked her, she was describing all this domestic violence and all these things in a previous marriage, and she'd been a military sexual trauma victim and all of this stuff. And she got married again, and she'd never disclosed any of this to her husband. Her husband didn't know she was on medications, didn't know shit. And so, those are things that she never developed. She never dealt with any of those issues. And so she brought this all into her relationship. And I think when you deal with more males, again, there's much more guilt and shame and stigma around saying, hey, I see a therapist. So I think, practicing and developing your own coping skills and self-care, either prior to your relationship and also continuing it during your relationship, is really a good thing. I'll let Dr. Doss.
We'll jump to Dr. Doss as well about the issue regarding finances, particularly In my experience, Brother Doss talked about brothers coming to a meeting and discussing what some of the issues are, and rarely might person say that they have relationship issues. I think that that's part of the challenge, I think, for African American men that I think you discussed very well, Dr. Johnson. But people will talk about financial considerations and finding ways to intervene and help in a more formal or structured way. Maybe I think a value we can add, I think, at this time in the lives of our brothers. Dr. Doss, you have any thoughts?
Go down the route of financial concerns and financial stressors. One of the questions that I ask is, for most brothers, are you the head of the household financially? Are you the primary breadwinner in the household? If you are the primary provider, primary breadwinner, most of the money and the bills are being paid for by you, and things get challenging and you don't have enough money to do the things that you need to do. You need to send a son to college. You need to send a daughter to college. You need to fix the car. You need to pay the mortgage, the light bill, the gas bill, the water bill. When you have financial problems, do you turn to your wife and say, I need some help? Do you turn to your wife and say, I can't do this? Or do you suck it up? Do you suck it up? And so I think there's a place for us to be able to say, I need help. And I think Dr. Johnson said it earlier, that men in general, and Black men in particular, aren't good at asking for help. When I think about relationships, a lot of times, if I've never seen a healthy relationship, if I've never seen a very functional relationship, and I've only seen dysfunctional relationships, and my partner, she's only been in dysfunctional relationships. So I know dysfunctional relationships. She knows dysfunctional relationships. What do you think we're about to have? We're about to have a dysfunctional relationship. And it starts to break down. The running joke about relationships is, if you want to have sex on a regular basis, don't get married. And so, is that a joke? Should it be a joke? And so, what kind of challenges do we have in our relationships? If I'm mad at you because you're not helping me financially, does that mean that we're about to have good sex? Probably not. I have friends and clients who, I hear interesting stories. Yeah, doc, we haven't had sex in a couple of years, so I just try to stop thinking about it. And so, is that normal? Is that okay? And it's not that, the Johnsons have to be, like the Lewises. Everybody's household is different. But the question then becomes, what works for you? What works for you? And when you do have a problem, whether it's financial or relationship problem, do you know how to reach out for help? If we are not trained about financial issues in school or high school and college, where do we turn to? Do most of us have a financial advisor? I'd be willing to say most of us don't. When it's time for us to talk about our relationships or other financial issues or things or sex, how many of us have been to a marriage counselor? Or do we only go to the marriage counselor when the marriage is just about over? So one of the questions I often ask when a couple comes into my office is, I need to know, is either one of you, have you already checked out? Because you can come, but if you don't really want to be here, I can't make you work on it. So being willing to say I need some help, be willing and able to say I'm hurting. As people look at you and your wife or your significant other, they say things like, "Oh man, they have a beautiful house," or they say things like, "Wow, they both drive nice cars," or they're a good looking couple. Y'all look good together. Let's take a picture. I'm gonna do a selfie and put it on Facebook, and then we start living the life of Facebook happiness. But when things are bad, do we go and tell our neighbors that, man, me and my wife ain't had sex in 6 months? Who you getting ready to tell that to? And the same, for your wife. who do you tell that to? And like I said, by the time you're having that conversation, you're probably already thinking about leaving. Right? So how do you begin to address those kind of things, financial, relationship, or otherwise, before it's too late? Hopefully what'll happen tonight is we'll realize that, hey, brother, it's not just you that's going through these things. These are things that everybody experiences at some point or another. And so how do we begin to talk about it? Maybe I've been down that road, and, not even as a psychologist, just as a brother, maybe I can point you in the right direction. I can tell you how maybe me and my wife overcame it. Or maybe you had an experience that might help me in my relationship. Do you think just because I'm a doctor, lawyer, Indian chief, engineer, cardiovascular surgeon, that I don't have problems? You're wrong. Right? So here's the truth about life and stress. It doesn't discriminate. It will come for me just as easily as it will come for you. Then the question simply becomes, what are you going to do with it?
Tremendous point. I want to kind of jump in, Brother Dawson, and really give both you and Brother Johnson a chance to address some of the medical complications that people have, that brothers have, that often, we call it somaticizing from a psychological problem to something that's more acceptable. So I love the way you end that piece. What are brothers going to do about it? Folks will talk about high blood pressure could be stress related, and if you got a chronic illness like diabetes and arthritis, your pain's out of control, what have you. But very often, unless you address and think about and manage the psychological component of stress, and tonight we're talking about stress management, you're unlikely to get your hands around the medical piece, let alone the ongoing problem of the stress psychologically that can cause other kinds of medical difficulties kind of going forward. I want to give both of you a chance to kind of talk about that, because I think very often that's a huge challenge, I think, in our community.
Yeah, Dr. Bailey. So yeah, almost it's very rare unless somebody's extremely young that we see no what we call medical comorbidities when they're either in our offices or in the hospital. So, we know that, there's, the idea of a healthy gut and, all kinds of, and I don't want to get too heavy into the psycho pharmacology and the biology, but, the whole concept, the old concept of mind, body, soul, psychosomatic, things are neurotic is quite common that we see. We see people, and oftentimes what happens is primary care will work them up, because people initially present with whether it's stress, depression, anxiety. The first person they're going to see is most likely the person that they trust is their primary care doctor, their family care doctor. We normally don't see folks until they're, extremely ill or, having severe panic attacks or, severe depression, whether to the point of suicidality. So they normally go in saying, my stomach hurts, my back hurts, my head hurts, my neck hurts, I just don't feel well, I feel tired all the time. When you think about something like depression, you think about, fatigue and low energy and, pain syndromes that are connected. And, oftentimes we even give medicines to treat both. This person has chronic pain and they have depression, and, what, kind of came first, the chicken or the egg. So we do see a lot of what we typically call somatization, which simply means that these mental health problems or this stress is showing up in your body in a physical way, that your body is having a physical reaction to what's going on with you internally or emotionally. And until you address those things, sometimes you don't get any better. Your symptoms certainly could potentially get worse if you're not addressing it. One of the things that we often tell people is, the old adage was mind, body, soul medicine. And that's still accurate today. Folks who have great physical health, great mental health, and great, spiritual connections, whether it's, practicing a certain religion or just believing in a higher power or believing in something greater than themselves, those folks typically have a healthier, happier life when you can have all three. And so getting that balance is very important. So, you know, when we do look at folks, you know, in primary care settings, you know, they should be screening for depression. They should be screening for anxiety, especially in somebody when the diagnosis is just not clear. You know, we've done CBC, we've done all this. I don't want to get too technical, but we've done all this medical workup, and the person's still saying, you know, doc, my stomach just hurts every single day, or doc, my head still hurts or my back still hurts. We really then need to look at, you know, what is really the root cause of that, and a lot of it could be stress. Because when I see these patients in my office, I often say, well, did you tell your primary care doctor X, Y, and Z? And they say, oh no, I didn't tell them. And so, did you tell them, you know, all the stuff that was happening in your life, or did you just tell them your head hurt? And so that is, you know, what we kind of focus on. But again, you know, this stuff, a lot of it presents in the primary care setting or the family medicine setting, but kind of not really told to them. Now, some, you know, and some doctors really hone in on it and know immediately. But in a very busy practice, sometimes the doctors just don't have the time to do a complete psychosocial. So, you know, when people disclose it, you know, I think it's much better. I'm going to let Dr. Doss add to that.
Right. So it's almost a trick question, Dr. Johnson. So I worked at Cook County Hospital, and so for you to ask the question, have you told your primary care physician, is it almost sounds like a joke, because invariably I saw Black men coming into the emergency room because they didn't have a primary care physician. Oftentimes the answer to that question was, what's a primary care physician? Right? Who is that? What did they do? Oftentimes, you know, in the Black community, the hospital is not the first place that we go. The doctor's office isn't the first place that we go. For some people, it's financial reasons. They don't have enough money to get good medical care on a regular basis. They don't have good insurance. Who's going to pay the $30, $40, $50 copay going into the office? And so, you know, on some level, you start to think that maybe we should have stock in NyQuil. We should have stock in Tylenol. We should have stock in, you know, various forms of ibuprofen, because we're getting treated medically over the counter. Or if we want to talk about psychiatric or psychological, emotional, mental health issues, does alcohol fix that? Does marijuana fix that? You know, doc, can you give me something to help me feel better? And one of the things that I try to make sure people are aware of is that there is no medicine that can make your behavioral problems go away. Right? There's no therapy, you know, that makes your emotion. You got to put in work. You got to put in work. Here's another one when you start talking about erectile dysfunction, which is one of the big things that we see. I work with a lot of men who have prostate issues and prostate cancer, not to mention the men that just haven't had sex with their wife in 2 years. But, you know, is it that diabetes caused that? Is it that high blood pressure caused that? And the thing that I remind people, the largest sexual organ actually is between your ears, right? And so where do you talk about, you know, what you're thinking, what you're feeling? Because generally speaking, men don't talk about not being able to get an erection. So again, you know, I work in groups where this is a common conversation that we have. We made it normal and safe for brothers to be able to say, man, I ain't been able to have sex, you know, and another brother say, well, this is what I've done, short of going to the gas station to get some blue pill, right? So this conversation tonight, like, for me, is a primer for us to begin talking about stuff that we really don't talk about. So the door is open.
You're on a great point. I want to kind of stay with you, Dr. Doss, because this issue regarding this discussion being a primer is key. for a lot of reasons. And one is, you mentioned alcohol, you mentioned marijuana. I think Shyamalan mentioned that piece a little bit earlier as well. The reality is brothers do have stress, and many do have coping strategies that they try. Some work and some don't work. And I think folks may not appreciate or think that they're trying something if they don't go to a professional psychologist or psychiatrist and address it in a formal way. So this issue regarding whether stress can be healthy or unhealthy comes to mind. Some would argue that there's some areas of stress. If you're afraid, if you're in college, you mentioned having a kid in college, you don't want your father to be angry at you if you don't make good grades. That drives you to do good behavior. Go to the library and study more and go to bed earlier. Stress drives that. So there's good stress, there's bad or so-called unhealthy stress. Managing the two and managing, I think, the coping strategies that we use, I think goes a long way toward determining whether or not one is going to have a positive or negative outcome in that regard. I'll come back to you, Dr. Dawson, try to hear what your experience has been like trying to help men in your practice address healthy stress from unhealthy stress and coping strategies.
So I like to think of stress as being on a, we call a bell curve. And it's kind of shaped like that. All right. So the idea is that if I don't have enough stress, I won't do anything. Right. So you need a certain level of stress to be motivated in life. For example, if I don't get this report in, I might not get a promotion. Or if I don't see, if I don't have enough billable hours, I might get fired or let go. If I don't come home before midnight, my wife gonna think I'm cheating. So the idea is that there are things that can contribute to me having some adaptive, healthy, functional behaviors, because I have a fear of what will happen if I don't do those things. So at an acute level, you kind of think of some threat has come to my life. Like I say, physically, mentally, emotionally, some threat is there. And so my body is saying, you need to do something. I have a test coming up next week. The fear of getting an F will make me maybe study. So that's healthy stress. Nothing wrong with that kind of stress. If you don't handle your business, some bad things can happen. All right. At its best, stress is acute. Now, at the point that stress becomes chronic and ongoing, now it starts to contribute to some other stuff. So like I said, it's just the idea that now I'm only sleeping 3 hours a night because, I wake up worrying and thinking about all that's going wrong, or what I can't do, or what I can't manage. And I don't have the answers. And I don't care how strong, how smart, how successful you are, you will not have the answers to everything. Do you have the answer for the pandemic? If you had a small business in Chicago and you owned a restaurant, did you have the answer for that? There are people right now experiencing Zoom burnout. Every meeting is on Zoom or Microsoft Teams or email burnout or texting burnout. When is too much? When is stress too much? When is it too much? And so, all you have to look at is turnover rates in companies. And it's a lot of that right now. On every other corner, you see a store that says we need help hiring right now. We'll give you $15 an hour because we can't get people. I went into a Cracker Barrel the other day. There were 4 people in the restaurant, and they told me it was going to be a 45-minute wait. I was confused. They said we can't get people. All right, so people are burned out, man. People are frustrated, and so, like I say, acute stress, normal, can be motivating, but prolonged, chronic, unrelenting stress, headaches, insomnia, hypersomnia, can contribute to diabetes, strokes. Stress doesn't help, when it's unhealthy, long-term chronic. Stress doesn't help anything.
Very good point. I think we have about 15 minutes in this section before we go to a final piece of 7:15. Let's open it up for any questions from the audience. And I do want to make sure I give Dr. Johnson a chance to address the last point you made subsequently, Dr. Doss, this issue about burnout, which he mentioned a little bit earlier. But I do want to make sure we open it up for any questions from the audience first during this 15-minute segment. And I think we'll ask our IT specialist to help us open up the mic.
Brothers on the call, this is the time. Ask those questions.
Open mic. I think we got one in the chat, and it really addresses this issue about the questions from the comments. And we definitely had a question, I think, about burnout. And I was going to go back to Dr. Good brother Shyamalan Johnson, that mentioned burnout a little bit earlier. I want to elaborate on that piece a little bit, because clearly stress can lead to issue of burnout. People have various strategies to try to manage it, some more effective than others, similar to the early conversation about Brother Doss. I'd like to kind of come to you, Brother Johnson, and hear your thoughts about that, because burnout is can be a huge issue in general. I think the reference to the challenges of the last year to year and a half during the COVID-19 pandemic period probably has worsened that risk. And we wonder, are we doing a good job as professionals educating, I think, our community in strategies that may work in this regard? What's been your experience, or what are some of your recommendations?
Okay, Dr. Beatty. So the burnout has kind of changed over the years, but there are kind of three classic categories of burnout that's measured. The first is just emotional exhaustion. People that, no matter how much I work out, no matter how healthy I eat, no matter how much sleep I get, or vice versa, I can't eat, I can't sleep, I'm not working out, and I'm just emotionally drained, emotionally exhausted. And that's one of the classic signs of burnout. The second sign is depersonalization. So, I wake up every morning and I don't feel like myself. I'm kind of going through the motions. When I'm at work, I'm just detached from it all. I mean, it's almost like an emotional detachment. I'm just kind of going through the motions. I don't, feel like myself, even the way it could be almost a physical thing where you're like, I just don't look like myself. So when you start feeling that way, that's definitely a sign of burnout. The third classic sign is like a diminished sense of personal accomplishment. So, I'm chair of my department, but it's just I don't care about that anymore. I just made partner at this big law firm, and I'm making all this money, and I should be just so happy, but I'm not happy. My business is thriving. My kids are in college. My wife, my partner is wonderful. I love, my kids are thriving, but I just don't feel that personal sense of accomplishment. I don't feel happy. And so those are some of the classic things, the classic symptoms of burnout. And we're seeing that, there's been a lot of studies in burnout. In my studies have dealt with burnout in physicians. And you would think, and also medical students, because people think, oh, you're in medical school, you should be so happy about to be a doctor. There was a meta-analysis done in 2016. It looked at about 183 studies. 30-something% of medical students identified as having major depressive disorder, and about 11% of those students actually were having suicidal ideation. And when they kind of looked at the data and compared it to residents and actually practicing physicians, the numbers are very similar. And so, because a lot of people think, oh, only poor, low achieving people are depressed. I mean, only, poor people from socioeconomic backgrounds, those are the people that are really depressed. Well, actually, it kind of cuts across the board. And when you look at medical professionals, and that's the data that I looked at, and this it may be extrapolates others. I'm just looking at medical people, high achieving people, great MCAT scores, went to these great colleges. The world is their oyster. They're going to go out and do all these great things. A third of medical working professionals identify in some symptoms of depression, and so it's very and the number one reason why physicians retire early or change careers is because of burnout. And so when you recognize that, and I think it's been recognized early on, I think the residencies now have like mental health days that you could take off or you could put in for. So when you do that burnout, again, it goes back to those kind of things we're talking about, taking some self-care days, reevaluating, what you control, how you react to it, and really, kind of reassessing where you are. And I say doing a in reality check. Like, 10 years ago, being chairman of radiology at Boston University was what I wanted to do, and it made me happy. But right now I'm not happy. I'm burnt out. I'm emotionally detached. I'm emotionally exhausted. I have no sense of personal accomplishment. So almost, like resetting yourself. And so that's what people have to do, when they get to burnout. I was telling Dr. Doss, this will be funny for some of the people on the line. We were talking about personal parameters about burnout. I said, Dr. Doss, this is my definition of burnout. If I'm going to a job and I have to sit in my car for 10 to 15 minutes and listen to gospel music before I go into the meeting or go into the building, that's probably a sign that I'm getting really burnt out, and I probably need to make some adjustments. So
that's actually very good one. While you're on that point, I'm going to jump into another one, and either you guys can take it. You've actually addressed a couple of the questions that came into the chat on burnouts. I appreciate that very much, Brother Johnson. One question is, how do you find a Black therapist? Brother Doss, you want to take that one? Johnson, you're already smiling.
I'm giving that to Richard.
So here's my experience. We are few and far between. And so you'd be amazed at how many calls and requests that I get. Doc, can you see me? I don't care if you can see me for just a little while. I don't have anybody black that I can talk to, any Black professionals. And the truth is, there are not a lot of Black male psychologists out there. And so people will sometimes go to their insurance provider and ask the question, can you tell me, who's a Black therapist, who's a Black doctor? And sometimes it gets down to looking at the name. Leroy Jones. Oh yeah, that sounds like a brother. Let me try him. So it can get crude. Or we look at the pictures just to find the race of the person. Oftentimes, if somebody's in therapy, in your family or even a friend, you don't necessarily know that they're in therapy. So, how would you be able to ask or know who to ask? Who might be able to make a referral for you to get a therapist of color? So, it's actually more difficult than you might think. You can also go to the Association of Black Psychologists. And so for all of the major cities, there's an association that exists. And if you call them, they can tell you who's on the rolls. And if I'm not mistaken, there's an association of Black psychiatrists. So psychologists, psychiatrists, Black associations exist. I doubt if you could go to APA and just ask that question. But we exist. If you are looking hard enough, you can find us. Here's the other thing, is that a lot of times if we're in private practice, our caseload is already crazy. I work for the Department of Veterans Affairs, and I do public speaking. But if you were to try to see me, you'd have to, be a combat veteran. So depending on where I work, might limit how many people of color I can see. So I'd say start with your insurance provider. Ask family and friends who might be in therapy, whether you know it or not. And then the Association of Black Psychologists and the Association of Black Psychiatrists. I'll leave it open for you, Brother John. Oh, and then look at the pictures on the sites, and ultimately you can look at the name. Shyamalan. That sounds like a brother.
Johnson,
Dr.
we got 1
Yes,
minute in this segment.
Dr. Bailey,
That'll make one point before we go to our brother Sterling. We got 1 minute, Dr. Johnson.
Okay, all right. This is a hot topic, and 1 minute is not going to go just. Let me tell you, number one, let me be practical. There's a website, Prescribers of Color, prescribersofcolor.com. Lots of African Americans and persons of color registered there. I'm going to say this: a lot of these institutions have not been very kind to persons of color, psychiatrists and psychologists. So we are not a part of a lot of these big institutions, and we're in private practice, and a lot of us do not take insurance. So I feel like, if folks want to see us, it's kind of like, folks with the Gucci purses and the Christian Louis Vuitton shoes and all that. I mean, my perspective is that people really want to see us, and they're willing to really commit to us. We're there, but we are there, but there are very few of us. And again, we're most likely not at these big major institutions, because institutional racism and all these things that we can't get into right now have driven a lot of us out of there. And, you can find us in small, normally private pay practices, and that's where we are. We have several people here in New Orleans, but most of us are small, private practices. So I'm going to stop on there, because that could be a hot button topic.
I would just put a few points in before we go to our Surgeon General, brother Sterling. Great comments on each of these issues. I love the question, because it does point out that brothers locally and nationally are thinking of where to go for help. One redeeming message of tonight's discussion has to be that help is available, and you can get it in a very proactive and effective way. It hurts all of our hearts when we see someone respond in a way that may be negative to themselves or their family, with violence or alcohol use, or all of the more unfortunate strategies people may use if they don't know of more positive things that they can actually do. I'm going to pull out an alpha card here and brag the fact that a brother, Napoleon Higgins, psychiatrist down in Houston, Texas, is now the new executive director of the Black Scouts of America organization that I think both brothers Doss and Johnson just mentioned. Very open, and he's in private practice, as I think brother Johnson just mentioned. It is true, though, and disproportionately, we are a subset of the American population professionals, psychiatrists and psychologists that are Black, that are less than 2% overall in both groups, as Brother Doss mentioned. So our numbers are small. We are more, as Brother Johnson said correctly, in private practice than in big settings or big groups. So very often, your insurance may send you to a big setting or big group, a university, or overall plan. And on that plan, there may be very few, if any, providers of African American background. That often leads to some of the challenges that I think brothers have. But I would like to end before we go to Brother Sterling by pointing out, if you need help, I think you go for help and assistance, and being aggressive about it really matters. Whether it's a woman who wants a woman OBGYN, whether it's a person who speaks a certain language who wants a person with that language or even religious background. There are a variety of cultural mores that clearly our data has shown are effective in helping persons get better, and this is simply to what overall credential that person has. So seek out somebody of a similar culture or race or ethnicity is a very acceptable thing to do, and I'd encourage it. Let's stop at that point and go to our Surgeon General, Brother Jeffrey Sterling, for some comments.
Fantastic discussion. I've really enjoyed listening to you. Subject matter experts really get in the weeds on these topics. To the assembled audience, welcome to Overtime. The purpose of this part of the session really is to empower you and to recap some of what you've heard and make sure that you leave this talk not just with the information you've already heard, but with some tools that you can work on and work with to handle the stress that is a part of your life. I really have 3 topics. And by the way, I want to welcome Brother Dr. Bailey to the conversation. You're such an expert that we would be remiss if we didn't get some comments from you on some of the topics that have been discussed. I'd actually like to start with reaffirming one of the comments that's related to the stress performance curve. I think it's very important for the audience to appreciate that stress really is a force, and with the appropriate amounts, it actually creates efficiency. So to the extent to which you're able to ride that wave, you will either not have your peak performance, you will be at your peak performance, or you will be crushed by the amount of weight. As a practicing emergency physician and hat tip to Brother Doss. We both trained at Cook County Hospital. I do want you guys to simply reaffirm in a concise way for members of the audience your best tips on how to manage the stress performance curve and to use it in ways that make the stress part of the conversation more oblivious and the performance part of the conversation more prominent. Any of you, go ahead and pick that up, please.
Well, I'm going to jump in, and I'll try to be brief because I think we want to hear from everybody. For me, the three key aspects to managing what I will call good stress, so that curve is actually moving in a positive direction. One, first and foremost, I think is to be real and honest and earnest with yourself and understand what your limits are. If it's in time, I mean, I'm a person who wakes up early and goes to sleep early. So I try to get up earlier because that's the time period when my stress is more positive. And I think I produce, I think, a much more proactive overall work product. When I went to med school, person talks about drinking more coffee and staying up late. That never really worked well for me. So the part about, I think, knowing yourself, being honest with yourself, put yourself in the best opportunity or time course so that the stress model will push you to a better performance, well, peak performance, as you point out, I think is very, very clear. And I think it's an effective strategy, a more effective strategy. Second thing I'd say, I think, in addition, is very often stress involves, for many persons, whether you are interacting alone or in groups or with others. And some people work different in different type settings. A lot of the stress occurs if you're in a setting that's not optimal for your best overall work output. So I think being a bit more selfish and understanding and choosing the right environments to be in, I think, are key. And I think very often persons stay in the wrong environment. We may have the wrong job because it's what somebody else thought we should have, or it paid more money. We may be in the wrong school because we went there for a different reason and we don't really perform best in that setting. I think not being afraid to say I've made an earlier snafu, mistake, if you will, and moving to a different setting where the stress that does engage pushes you to a better performance, I think is also, I think, a notable recommendation that I like to make, I think, in my own practice where I am. And finally, I kind of try to tie a point that I think Brother Johnson made. You know, I am at this point at a large setting at LSU, a large university med center here in New Orleans. And there's some additional stressors. In fact, we use this term now called the minority tax. If you're in a setting like this, the African professionals are asked to be on more committees and do diversity in their regular job, and they're doubly viewed for or assessed, I think, for overall performance. I think one has to be very mindful and cautious and not allow that to become overwhelming and to try to overextend ourselves in areas that may not actually lead to the kind of growth and professional augmentation of your career that's beneficial. That's true, I think, whether you're in private practice and your numbers may be, I think, about productivity and patient performance, as compared to if you're in a university setting, there may be some other challenges, I think, that you're graded on. All three issues that I think are helpful in thinking through how to manage stress, how to optimize so-called a positive stress or a good stress for you to have a better overall performance for your own health, and I think for your financial or educational or work-related or work productivity.
Now, one of the things, are you ready? One of the things that I think is important, you know, as you're in the hustle, in the grind, trying to make it to the next level in your career, the question becomes, if everybody is stressed and everybody's getting a divorce and everybody's in bad health, and I know people in the legal field, so I know plenty of lawyers who that describes. I know plenty of physicians whom that describes. And I think about there have been 3 suicides in the last 6 months in the Chicago Police Department. So police officers experience it too. So just because you're in a position of power, prestige, recognition, maybe well paid, doesn't mean that you are immune. And just because, you know, Dr. Bailey's been able to do it for 30 years, doesn't necessarily mean that you'll be able to do it for 30 years. I talked to a number of physicians who talk about being stressed and burnout because it's not what they thought. Think about the pandemic. One of the things that I've heard ER physicians and ICU physicians say on television in the last 18 months is, you know, I went into this profession because I wanted to save lives, but I'm losing 10, 15 people a day. And that's more emotionally than I was prepared for. So if that's your reality, where do you turn? Can you quit? Are there things that I can do before I quit? And, before I said, just because I can tell you what to do doesn't mean that you'll do it. So that idea that just because you know what to do doesn't mean that you'll do it. So exercise. When was the last time you exercised? If you have a very busy life, very successful life, have you made time to exercise? Is that important for you? Brother said last night on the call, if you identify yourself as a successful Black man, if you're an alpha who's, in his grind, doing his thing, you should make a part of the equation working out, meditation, yoga. What kind of food are you eating? So if you're in the hospital and you're doing 10-hour shifts, or you're at the law office and you putting in 12-hour days, what are you eating? So, that hamburger and that hot dog that you just had time to eat and you just trying to wolf down some processed food, maybe you need to reconsider your diet. So then the question becomes, what priorities have you made about your mental, emotional, and physical health? If that's not a priority for you, the easiest thing to do in life simply is to do nothing. So, if the thing that you've been doing hasn't been working, it's not up to your boss to change it. It's not up to your wife to change it. It's up to you to change it. Slow down, take a break, take a vacation, be less hard on yourself. When you think about yourself as being a man, what does that mean? Does that mean that I can't talk to anybody? Does that mean that I have to suck it up and stick it out? Or does it mean that I have options and that I can be mature enough to make healthy, decisions for myself so that I can be in this game for the long haul? Right? And again, is there a dollar figure that makes any amount of a stress or high levels of stress acceptable for prolonged periods of time? So you can do anything for a little while, but you're like, I thought I was just going to be doing these 12-hour days for 3 months or 6 months or a year. Man, we 5 years in. I'm doing double shift. I did 16 hours last night. If that's your conversation, brother, that's nobody's fault but your own. And so don't let this ball is rolling downhill behind you. This wealth ball or financial incentive ball drive you into an early grave.
Did you have anything you wanted to add quickly, Brother Johnson?
Yeah, I think 3 points, for as far as is positive stress. Number one, make goals, whether it's, this one specific thing you want to do, organize yourself, and then, go after those goals, but then have a balance. Like if you only get 80% of that done today, that's fine, but still have a balance. Because I think you get into burnout when you don't have a balance. So one of the things I can tell you personally, I have a certain cutoff. Like by 7 o'clock, I may say, okay, I'm going to stop and just go to the gym, or I'm going to stop and I'm going to cook, or I'm going to stop and I'm going to listen to music for 30 minutes or whatever. So, you've got to find a way to balance that all. And you're the one, like Dr. Dell saying, no one's going to do that for you. I mean, if you work 90 hours a week, your job will take 90 hours a week. If, they'll take whatever they can. So, you're the one that has to set that. But if you set realistic goals and still find that balance, and it's hard, but, try to find that balance. And we're talking, 15 to 30 minutes a day of self-care, whether that's walking, listening to music, exercising, talking to a family member that you haven't talked to in a while, whatever it is that could de-stress you. If you do those things and you make that a daily routine, that will eventually lower your stress. People wait till they've had a heart attack or a stroke or something to make all these, and we're talking about if you make those small little changes every day, you'll eventually lower your stress, but you got to commit to those daily changes.
All right, thank you. We're going to come back to some of the points you're making. That's a nice segue to the next item, and I want you guys to stay with me on these points because we'll get to the rest of it very briefly. stress is reconciliation more than it is being in stressful environments. Being an emergency physician or a combat veteran are things. Swimming in shark-infested waters are things. These things become stressful when you're unable to navigate the shark-infested waters or to effectively deal with your surroundings. So it would seem that one of the things that I want the audience to be aware of is that you need to be mindful of how to assess your surroundings and to know when your behaviors represent appropriate versus inappropriate control and navigation of your environment. So the question to the panel is, do you have tips that you could give to individuals in terms of monitoring stress assessment? How can you get people to come outside of themselves and look down upon themselves from 30,000 feet and have a better appreciation for whether or not their responses are either suboptimal or represent undue amounts of stress?
I'll jump in first and I'll be brief. I think that we deep down as individuals are aware when we operate in kind of outside our own comfort level and comfort zone. When we do so, we maintain a level of anxiety that we may only be aware of internally on our own. Others may or may not. But very often we have to find some other kind of compensatory strategy to manage it. I mentioned some of the negative issues earlier. Excessive use of alcohol is a perfect example, other kind of items. So I'd simply encourage brothers to think clearly about doing a true, reevaluation of how you're managing your life. I love Dawson's commentary earlier about, legal issues and financial issues, relationship issues. And I think, Brother Johnson's comments about burnout and being mindful and aware when you actually are pushing the envelope beyond which you can handle. But I'd end by saying it's issue about being earnest and honest with ourselves, what we can handle, finding some defense mechanisms and some compensatory strategies, coping strategies they're called, that work for us, different things for different people, and then being a bit selfish enough to choose time to do something. Some folks talk about exercising more, others may find other strategies that actually work for them, but I think that this issue regarding doing that before it becomes knowledgeable to people outside yourself, externalized, I think are going to be key. And to me, that's a tip that I think only person internally can decide on their own how to manage.
Thank you.
Here's the thing that I'd say, that most people are not good at assessing their stress. They've been at that level of stress so long that it's become normal for them. So my experience is that oftentimes it's a significant other, a wife typically, that can say, he's more argumentative, he's angrier, he's easily agitated, he wants to fight all the time, he's not sleeping well, he's starting to lose weight, and oftentimes my clients haven't recognized it. I'll have a couple sitting in front of me, and I'll say, "How are you doing?" The guy will say, "Man, we good. I ain't got no problems." I look over at the wife and she's crying. So in addition to being able to self-assess, I think it's important to have somebody in your life. Typically it's going to be the wife. She's going to see it first.
Well said, Brother Johnson.
Sorry, I'm on mute. I simply ask people, what gives you joy and happiness, and how often do you do it? I mean, if you are, always upset, going back to always angry, always irritable, always upset, and sometimes people, like Richard was saying, it's become such a common state for them, they really don't understand that. But if you could pose the question to people, when is the last time you felt happy? When is the last time you felt at peace? When is the last time you felt calm? And if they can't answer that really rapidly, then you know that the anxiety and the stress is really almost 24/7. Again, some stress is normal, but if the stress is 24/7, 365, you're always irritable, you're always sleepy, that's a serious problem. But that's a self-assessment question. How often am I happy, and what brings me peace and happiness, and how often do I have that? And if that's not something on a daily basis, or at least, multiple times a week that you have, I would say that your stress level is really high, and you need to start working on some of these management techniques to lower your stress.
So perhaps sometimes you don't need a break, you need to change your environment. How about that?
Yes. What you can control. What you can control.
Yes. I want to cut you guys loose on this next question because this gets into management. And part of these webinars really is about empowerment. And we can actually suggest that in many ways, stress is a lack of the ability to say either no, not now, or not like this. I would actually like for you gentlemen to talk about different components of stress management, avoidance of stress, not being in that environment to begin with, empowerment. How do I better deal with these environments that I find myself forced into? And additionally, revisiting the topic of how do I find help, whether it's from my family members or from professional counselors, and recognizing when that need would exist. So once again, let's talk a little bit, recapping if we can, some tips for stress management, both that are empowering and allow us to step outside of ourselves when we can't handle things ourselves.
Let me go first. Here's the first thing that comes to mind. You have to be careful what you believe, right? So if I believe that saying no to somebody might get me fired, I won't be saying no much. Or if I believe that saying no to a family member, a wife, a mother, or a child, if it's going to hurt their feelings, I won't be saying no much. So how can I say no and be comfortable with it? So the idea, be careful of what you believe. Be careful of what you believe. Clinically, we talk about this idea of how can I be assertive? All right. So being a passive or passive aggressive is basically having stuff happen to you and you just take it. Having work put on you and you just take it. Being overworked and you just take it. Being given, the night shift and and you just take it. Or the flip side is being aggressive, where you are given some stuff that you don't like, but in the process of speaking up about it, now you cussing people out. You asking people, you know who I am? Who you think I am? And being disrespectful and disregarding their feelings. So there's this thing in the middle called being assertive. And so how can I learn how to say what I need to say? How can I check you without being disrespectful? And it's something that a lot of people don't know a lot about. I'd say get a book on it. Go to therapy, learn how to do it. But I think a lot of it starts with what you believe. That passive piece. I believe if I say something, I might get fired. If I say something, I might hurt somebody's feelings, and I don't want to do that. And like the flip side of going off on people, putting people in their place and checking people, that's not healthy either. So learn how to be assertive.
Okay. Other thoughts?
I would say, again, I always tell my patients the most powerful word in the English language is the word no. And when you start telling people no, you'll really find yourself. But, again, like Richard is saying, you don't want to say, you don't want to go off on people, but you want to tell people, when you really find out who you are and what you're comfortable with, but that also comes with a sacrifice because, you may lose your job, you may lose friends, you may lose a family member, because if you've always said yes and people have always come to you and you're the one who's always carried this, and now that the load has gotten too heavy for you and your anxiety is through the roof, and now you feel like you have to say no. But I tell you a personal example happened to me today. There was a new social worker around, and make a long story short, one old social worker came in and said, "Oh, she's new. Well, you should be nice to her." And I said, "Well, my goal is never to be nice. It's to be fair and balanced and honest and make sure that it's a positive environment for everybody." So, we have a world that people try to split us into good versus bad, yes versus no, but that's not the real world. So, you really have to find some sort of balance and protect yourself. But one of the things I always tell clients is that when you learn to say no, people will then change the way they deal with you. But if you're continuously taking on all these things and doing all these extra things, people will continue to do that. So, one of the things you can do is really set boundaries and really find out who you are and what you're comfortable with. And once you do that, people will adjust. The world will adjust to you instead of you adjusting to the world. But if you're constantly adjusting to all these things around you, it's going to be very difficult for you to find balance and to find peace, because then you are reacting to everything instead of, being grounded in who you are. So if you start reacting to all of this stuff and all of people's problems, it's going to be internal chaos. So that's typically what I tell my clients.
I would just add, just briefly, the term empowerment, Jeff, really resonates with me. And throughout my career, I think I've really moved increasingly toward a mindset, especially when working with African American males. Often persons come in and they close the door, and they can finally take off this, veil shield of power and perilous, disregard for all of the bulls and arrows that kind of come at them every day, and they want to have some place where they can go where they feel safe. It is a bit, I think, empowering to give a person a chance to be human. And the human side, I think, comes out of all of us. We may be men, we may be black men, we may be alphas, but we are human. And the struggles, I think, that the life, that the bows and arrows of life that throws at us, not only can be, but is, at some point in time in everybody's life, a bit overwhelming and overtaxing, and something that we just are not able to handle or manage. And that's, I think, the piece regarding why I often say, persons may not want to come to my office professionally, but they want to give me a call. They want to meet at a Starbucks. They want to touch base. They may want an informal setting, or what I continue to consider a session. Actually, I can tell when a session is happening when somebody's getting or gaining the value that we as medical professionals, I think, can offer. So this process, I think, of being able to reinstill some sense of powerfulness, empowerment, I think is essential, and I think key for African American mental health professionals like all of us, even you as an ER doctor, as you point out, to be mindful of, because that's what I think more than the individual advice I give a man is the feeling that he's not unworthy because he feels like he's losing at the game of life. Outside the psychiatrist's door, it can be a bit overtaxing. Inside, we got to kind of rebuild that person's strength and confidence, i.e. empowerment.
You gentlemen are phenomenal. It's perfectly obvious why you're as successful as you are. I can't express my appreciation enough to Drs. Doss, Dr. Johnson, and certainly to Deputy Surgeon General Ram Kennedy Bailey. I want to end by piggybacking off of a comment that Edward Scott put in the comments that are two lessons that I've learned that are particularly important in terms of dealing with stress. My mother taught me a long time ago that, to one extent, the more that your life allows people to have to deal with you instead of you having to deal with them, you're going to be less stressed out. And that simply means it doesn't mean you have to rule the world. It simply means that as much as you can place yourself in environments that are nurturing and supportive instead of those that are challenging and those that are deleterious to you, you'll do better. And I will point to another anecdote. Again, I'm an emergency physician, and rule number one, as I describe of emergency medicine, is when it hits the fan, take your own pulse first. Because at the end of whatever happens in my emergency departments, I'm going to be okay, figuratively and literally, at the end of the conversation. And what that means really is just gather your thoughts, gather yourself, and enter into a situation. Remember, navigating shark-infested waters is actually a thing. And if you build the skill, it doesn't happen overnight. You will look completely different 6 months from now than you do today if you actually try to be active, if you act on your environment, if you try to bend the universe to your will more than you probably do now by being a passive observer and recipient of what the universe has to offer. You probably will do better, and you'll be more in sync with it all, and you'll probably find yourselves less stressed out. I want to thank everyone again for participating. One thing that is very important in these conversations is that we're going to be covering a broad range of topics, and health is what this is all about. This is the intersection of mental, physical, and so many other types of health. And one thing that I will point out to you, sound mind, sound body really is a thing. And if you're in great physical shape, you're going to end up with great mental shape. The release of endogenous opiates, feel goods, really is a thing. And if you are healthy in one regard, you'll be healthy otherwise. And all of my psychiatric colleagues and friends will tell you that before we get into pathological mental illness, we often have to do medical clearances to make sure that diseases actually aren't affecting the mind in that way. So keep that in mind. Sound mind, sound mighty. Take care of yourself overall. On a programming note, next week at this time, we will be talking about prostate awareness. We'll be talking about prostate cancer, both assessment, diagnosis, and treatment. So please come back. In the upcoming weeks, we're going to be talking about healthy aging, cholesterol education, and so many other topics. The Surgeon General Initiative means to cover the span of what matters to you, your families, and your communities. And I couldn't be more appreciative of everyone for giving us your time. And hopefully you got something out of this. Thank you for your questions. And we look forward to seeing you again a week from now at 7 p.m. Central. Actually, that's 6 p.m. Central, 7 p.m. Eastern. Have a great evening, everyone, and thank you again.